as you'll remember from the presentation, I like to set the gingival margin first before I start doing my preparation, before I start doing my depth cuts. A question that I get asked frequently is, do I pack cord, retraction cord, when I'm doing my veneer preps? I do use some sort of retraction. It will either be retraction cord, or I will use some sort of cord material, some cord astringent material, to move the tissue out of the way. But I do that after I've prepped my margins. Because what I want to do is I want to place my margins at that cervical level, right at the gum line, and then move the tissue away from the margin so that I get a great impression with the tissue retracted away. So in this case, in a case like this in the mouth, I would go ahead and prep the teeth with the gingival margin as it is. When I get ready for the impression, then I'm going to start packing the retraction cord then. The first burr that we're going to be using for the preparation is that micro burr, the 830M012. That's the burr that we use to help shape the gum tissue. What I really like about using this burr, and I talked about this in the presentation, is it has the burr head is about 1.2 millimeters in diameter. The shank is about 0.7 millimeters. So it gives me about 0.5 or about a half a millimeter, about 0.25 on either side of the shank, which will give me close to my 0.3 millimeters reduction I need for that gingival margin. What I also like about this burr is that it's got a very long shank, so it's easy for me to be able to see the preparation without the burr, without the handpiece getting in the way. So let me show you. So I don't want to tip the burr this direction because that can give me a much deeper margin. I want to keep the burr in alignment with the tooth so that the burr shank is literally up against the side of the tooth, and that's how I'm going to create my margin without giving excess depth. Remember from our presentation, as we come around into the mesial, we're going to be tipping our handpiece into the interproximal to create that elbow design and then bringing it back up towards the incisal. As we talked about in the presentation, the distal margin is not as aesthetic, so I'm not worried about hiding that margin as much as I am on the mesial, which is a far more aesthetic margin. All right, so let's do our preparation here. And watch as I tip my handpiece to create that elbow design, and then swing it towards the incisal or the cusp tip area. It's important in this traditional veneer preparation that we're keeping our preparation margin away from the contact. So we're going to be buccal to the contact. If I start getting into the contact area, then as we talked about in the presentation, then that's going to be more difficult for me to manage, and I may just have to go all the way through the contact. So my goal is to keep my margin buccal to the contact. Now after we've created the mesial portion of that margin design, now we can come around and start doing the distal portion of that margin. When we talked about the prep less design during the presentation, this is essentially, with just some smoothing and some modification, this would be my prep less design for my veneer. Setting a margin to make it easier for my ceramist to be able to define the margin and define the delineation for the final of the veneer when they're creating the veneer. Secondly, for when I seat the veneer, much easier because I'll have a positive placement of how to seat the veneer. And the third issue is it's probably better for the soft tissue if I have a much better, much more natural emergence profile than if my veneer is sticking out in a total prepless situation. So in a prep-less situation, creating that margin design, I think gives us a huge advantage for our technicians, for us as we're seating the veneers, and I think it's healthier for the tooth overall. All right, so go ahead and prep your margin. Remember, don't drive it through the contact. Create that elbow design towards the mesial, and I'll meet you at the next module.